I'm Matt Bruns. I'm a board-certified nurse practitioner with a certification in orthopedics. I'm also a certified clinical densitometrist at SSM Health Orthopedics. I see a lot of general musculoskeletal type complaints of pain, aches after injuries, trauma, fractures, the whole gamut of orthopedics from basically childhood to older age, and with an expertise or an interest in osteoporosis care. So I try to see patients after they've had a fragility fracture, talk to them about their increased risk of future fractures, but try and make a big difference in those patients' lives to try and prevent those subsequent fractures from happening. My approach to patient care is to try and be a very team-oriented approach. I always like to make patients aware of their treatment options. I tend to be very conservative in nature with regards to treatment recommendations, leading up to the most significant option of being surgery most of the time. But I like to exhaust or at least have patients fail conservative treatments before we jump to the bigger type, more aggressive therapies or treatments. So, but at the end of the day, it's more of a team effort. It's not a matter of me looking at an x-ray and telling them, look, you need to have this or that. It's a matter of me giving them their options, and together we kind of decide what do we think is best for you and your lifestyle, and how do you best feel like we should proceed. I think what we're seeing already with a dedicated bone health clinic is we're already starting to impact patients' lives in a positive manner, in a way. For instance, when a patient comes to the hospital currently after having had a hip fracture, we have put a series of protocols in place with the care managers and the nurse navigators and coordinators so that these patients already have an automatic follow-up with the bone health clinic afterwards, all in an effort to not only provide them education about their osteoporotic fracture, but how we can prevent these fractures from happening in the future.